my name is Laura Kelly. I'm a historian of health and medicine based at the University of Strathclyde in Glasgow. So my work has focused on women in the medical profession, but also more recently on contraception and activism around reproductive health in Ireland. So for a lot of the 19th century, really, there was very little understanding of women's health conditions, and particularly of women's psychiatric conditions. So really, for most women in this period, it was expected that you would marry and have children and kind of subscribe to these social norms. And so the ideal woman was expected really to be the kind of angel of the house, gentle and kind, devoted to her husband and children. And really any deviation from this behavior was really pathologized. So the reproductive cycle, for instance, was medicalized in the 19th century, and menstruation was often blamed for disrupting women's minds. And one such illness, which was linked specifically to women and their reproductive cycles, was hysteria. So hysteria was used as a blanket term to cover a range of ailments, which could include fainting, nervousness, anxiety, insomnia, nymphomania, sexual desire, and melancholy. And it was really thought to be a disease that affected women primarily and was often linked to sexuality. So women who were thought to be too sexually forward, for instance, were often classed as hysterical. Then just talk a little bit about childbirth. So without access to adequate birth control in the 19th and early 20th century, women in Ireland generally had large families, as most people know. There were also very high maternal mortality rates, which meant that childbirth was a huge risk for women in the period. So in the 19th century, the most common cause of death in childbirth was something called puerperal fever. And this was basically a disease that came about as a result of infection during childbirth. And the death from this condition was often very swift, but extremely distressing for the woman, and there were very limited treatments for it. So from the 1920s, doctors started to recognize that there was a desperate need to improve prenatal care for women to help combat these high maternal mortality rates. So you start to see improvements in prenatal care, in midwifery, and also in hospital care. Also from the 1940s, you start to see penicillin being used, and mortality rates from puerperal fever start to decline. However, it's not really until the 1950s that you really see a considerable drop in maternal mortality rates in Ireland. And really, as Lindsay Erner Burns' work has shown, it was infant mortality that was really the kind of focus of state efforts in this period. And also, of course, it's important to add here too that the medical profession was really dominated by men in this period, which is likely to have shaped priorities in terms of research into women's health and how women's health conditions were understood. Yeah, so in the 19th and kind of leading into the early 20th century, so medicine was really not seen as a career path that was fit for women at the time. So you see a lot of arguments against women, which were based on contemporary beliefs about women's physical, mental, and emotional natures. So for instance, women were not believed to be emotionally capable enough to withstand the pressures of a medical career. And there was also concern that women were too gossipy, so they wouldn't, be able to kind of uphold patient confidentiality and things like that. There were also a lot of concerns about medical education, that it wasn't a proper thing for ladies to be concerning themselves with. So things like dissection weren't seen as, a proper kind of ladylike activity. Menstruation was often viewed as a barrier to women studying medicine as well, because it was felt that periods were disruptive to a woman's mental capacity. There were also concerns about maintaining the stability of the family, and these fed into wider fears about women in higher education. Furthermore, doctors were also concerned about increasing professional competition. So men really had the monopoly over the medical profession at the time. So they were quite worried about women coming in and entering into spheres of practice such as obstetrics and gynecology. On the other hand, though, those arguing in favour of women entering the medical profession suggested that there was actually a great demand among women patients themselves for women doctors, and that there could be an important role for women doctors in the missionary field. So in terms of Ireland and the admission of women to the medical profession here, so my research has shown that Ireland was actually quite open to the question of women's admission to the medical profession. So this was a really controversial issue in the 19th century, and following the registration of two women doctors, Elizabeth Garrett Anderson and Elizabeth Blackwell, medical institutions in the UK closed their examinations to women. So that basically meant women couldn't actually become registered to become doctors. So it wasn't until 1876 that you've got something called the Enabling Act, which meant that institutions could open their examinations to women if they wanted to. So the King and Queen's College of Physicians in Ireland, which was later the RCPI, was the first institution in the UK to take advantage of this clause, and it registered the first women doctors in 1877. There's a few reasons for this. One of them was that the college felt that there were financial gains that could be made from admitting women to take their licenses, but also there were many members of the council at the time who were actually, it didn't have any issue with women studying to become doctors. And then following this, you see women being admitted to Irish medical schools from the 1880s, and the first generation of women doctors who trained in Ireland reported favourable experiences at medical school. So unlike a lot of medical schools in Britain and the US, women medical students in Ireland were educated alongside the men, with the exception of anatomy dissections, where often, you know, there'd be a dissecting room established especially for women. However, in spite of this, it's clear that you kind of see these Victorian arguments against women studying medicine prevailing. So like in student magazines in the early 20th century, female medical students were often characterized as being bookish and cold, defeminized, and these kinds of negative traits. And although it's clear that women and men were educated together and they did their hospital training together, women really occupied a very separate social sphere apart from the male students, and this was reinforced through their living arrangements and separate social activities. But also you see it with, you know, separate ladies' rooms established for women, and also women sometimes not being admitted to medical student societies, such as at Trinity. Women weren't admitted to that society until quite later. And this kind of plays out in women's careers as well, this kind of separation. So a lot of the first women doctors go into careers in general practice, and they find it quite difficult, I think, to kind of get into kind of the other kind of specialisms in medicine, such as surgery, for instance. Yeah, so from 1922, with the foundation of the Irish Free State, Ireland really became a lot more conservative, as the Catholic Church really wielded influence over the Irish government to ensure that the Irish state became one that really enshrined Catholic values. So you can see this with a range of laws that were passed in the 1920s and 1930s, which reinforced these kind of Catholic moral codes, but also a series of official investigations, such as the Carrigan Committee, which generated lengthy reports, which themselves then often led to legislation which addressed moral and social issues. So in 1929, you've got the Censorship of Publications Act in Ireland, and this is really important because it basically bans any literature that was deemed to be obscene or which dealt with the issues of contraception and abortion. So really it means from 1929, it's very difficult for men and women in Ireland to gain any information about birth control. And then from 1935, you've got the Criminal Law Amendment Act, and this basically criminalized contraception. So it kind of banned the import and sale of contraception in Ireland. And this law was in place until 1979, when the Family Planning Act was introduced. So in terms of kind of exceptions to the law, so you could get the contraceptive pill in Ireland from 1963 onwards. So the pill was marketed as a cycle regulator, but this meant that you really needed to have a sympathetic doctor who would actually prescribe it to you. So for the majority of the population, really, access to contraception proved difficult and in many cases impossible. So the 1979 Act really was a big disappointment to campaigners, both in favour and against access to contraception, because it meant that although contraception was legally available, it was only meant for bona fide family planning purposes only. So this was widely interpreted as meaning that only married people could get access to contraception, and it also placed a lot of power in the hands of the medical profession. However, the change in the law didn't mean that access was widely available once the law came in, and access to contraception still really depended on class and on where you lived. So women who lived in the cities of Cork, Galway, Limerick and Dublin could have got access through family planning clinics in those cities, which provided contraception from the 1970s onwards. However, these really catered towards middle classes, and a lot of the people that I've spoke to in my project talked about kind of the fear of being seen going into the clinics at this time. Some men and women also were able to get condoms from England, or if they were living in the border counties, it was possible to go over the border to get contraceptives that way. For women, it was possible for some women to get access to the contraceptive pill. So the pill was prescribed for menstrual irregularities. So if you went to your doctor and said that you were suffering from menstrual irregularities, you could possibly get the pill that way. But really, it depended on finding a sympathetic GP who would prescribe it. And also, a lot of women who access the pill, they talked about the kind of religious qualms they would have felt about this, that it was going against their faith or their religion to actually do this. In terms of access to abortion, Cara DeLay's work has shown that there were networks of abortionists in Dublin which provided illegal abortions to women in the early 20th century. And it's really difficult to know how many women were actually going down this route, because the cases would have only come to court if something went wrong, such as the woman died, or if there was a court case involving charges to prosecute a backstreet abortionist. It was also possible for women to take preparations that would help to bring about a miscarriage or procure a miscarriage, as that was described at the time. You also see infanticide is actually quite common in the 19th and 20th century. So Elaine Farrell and Cliona Rattigan's work has looked at this. And then from 1967, abortion was decriminalised in Britain under the Abortion Act. So from 67, you start to see women travelling to the UK for abortions. But again, that would really have depended on class, because it would have been very expensive at the time for women to do that. So kind of in reaction to that, in the 1980s, you see the Irish Women's Abortion Support Group founded in London, which helped Irish women who were travelling over for abortions. And you also see the foundation of the Women's Right to Choose group in Dublin in 1979, which actively campaigned for the legalisation of abortion in Ireland and really provided support and counselling for women with unplanned pregnancies as well. So the Eighth Amendment, that really obviously comes in 1983, and really the kind of debates around abortion really start following the legalization of contraception in 1979. So a lot of the kind of conservative groups who would have been campaigning against contraception were very concerned that once contraception was legalized, abortion would soon follow. So they really start to mobilize, and they come together to found the Pro-Life Amendment Campaign in 1981. And this organization campaigned in favor of the Eighth Amendment and introducing the Eighth Amendment into the constitution in Ireland. So in reaction to that, you have the anti-amendment campaign set up, and they were really concerned about the kind of the vague wording of the amendment, and the possible risk to the health of pregnant women that the amendment could cause. So there's a really bitter, very polarized debate on this issue in the early 1980s, which leads to a referendum, which, as almost 67% of voters voted yes, and 33% voted no. So the amendment comes in then in 1983. So I think one of the kind of key moments following the Eighth Amendment is the X case in 1992, where a 14-year-old girl was prohibited from going over to England to have an abortion. I think that's a really important turning point in terms of attitudes towards the Eighth Amendment, but also following that, you've got the death of Savita Halappanavar in 2012, and that really, her death, I think, really resulted in the mobilisation of pro-choice groups in Ireland around the issue, and really, I think, started to change people's thinking about the Eighth Amendment and attitudes to abortion more widely. If you look back to the Abortion Act in 1967 in Britain, doctors really had an important role then in the kind of debates in favour of decriminalising abortion. So doctors in Britain were really concerned about backstreet abortions and women that were dying as a result of backstreet abortions. So really they wanted to make abortion safe and outlaw this practice of illegal abortion. However, abortion is an extremely contentious issue and a personal one as well, and people have very strong opinions on it. So in Ireland during the 1980s, there would have been members of the medical profession on both sides of the campaign. So in favour of the Eighth Amendment, doctors would have been arguing, based on ideas around life and when life begins. But also concerns around kind of the impact on, women that abortion could have. But then on the kind of anti-amendment campaign, you see a lot of doctors who would have been involved in, the family planning movement in the 1970s, and they were really concerned about, the actual workings of the Eighth Amendment, the risk that it would have for women's health. So they campaigned against it. However, as time went on, the Eighth Amendment really illustrated the difficulties that such a rigid law posed, and more recently you start to see doctors, and particularly younger doctors, mobilizing in groups such as Doctors for Choice, speaking out in favor of access to abortion, and really they're kind of coming at it from a rights issue, a women's rights issue, and the impact that lack of access to safe abortion can have on women's health. I'm hoping to develop a project which is looking at the history of these conditions in Britain and Ireland, and my plan is really to conduct interviews with women experiencing their conditions, and really I think to kind of reintegrate women's voices into the kind of historical narrative of women's health. And again, really just looking at why doctors haven't paid enough attention to these conditions, why women really struggle so much, in the case of endometriosis and PMS and PMDD, to get an effective diagnosis and an effective treatment. Why there's so much silence and stigma around miscarriage and menopause. And also I've been looking kind of at the work of activists and charities, which really, in the absence of kind of medical professional involvement in these issues, they've really been the ones that have kind of publicized these issues and made demands for better care and research into women's health.